I want to give all praises to Yahawah, Bahasham, Yahawashi, Bahasham, Qadash. I want to give double honors to the apostles of Great Millstone who teach every well where I got this truth from, and also the sincere Akims who push this in truth and sincerity all across the world. I want to say Shalom, man. Yahawah in Hebrew name, in the Hebrew tongue, Salaki, means he is, he exists. The son's name, Yahawashi, means he is the deliverer, the savior of Israel. I want to do a lesson through the spirit of Yahawah, Bahasham, Yahawashi, and I hope you're going to be edified. This is the book of Jeremiah, chapter 13, verse 7, and it reads, Alas, for that day is great, so that none is like it, is even the time of Jacob's trouble, but he shall be safe out of it. Yeah, man, because Jacob's trouble is already started, man. We are in the first, almost going to the second wave of Jacob's trouble, So, because man, when they're gonna find the vaccine, and they already have it, I think, but they wanna see how the population is responding on everything, so they can push it much further to a certain extent that it's lucky that everybody's gonna bow and gonna follow, and take it. And of course, all across the world, and especially you Jakes, man, you are the target, you are the target, man, especially in the States, also here in Europe, in Africa, in South America, they're targeting Jake. They want to get rid of a lot of you Jakes, That's why in the States they make Jake the face of COVID-19, And you see what's happening in the States, man. Food shortages. They rousing up Jake. I was seeing also some video in Brooklyn of in New York, and it was in Brooklyn they was rousing Jake up because of social distance. But when you was seeing in somewhere in Manhattan in a park where so-called white man, the Edomites were, they did nothing, there was peace and quiet. He didn't see police rouse them up. So yeah, man, so you see they don't give a fuck about you, Jake, so you are their worst enemy, It's always been like that, and it's always be like that. And the same we have over here too, man. And in the Netherlands we have also the same problems, everywhere where the so-called white people, Edomites are, they don't do so much. But when you go to the neighborhoods where Jake live, they patrolling over there, giving everybody fines, and the people are really the ones who don't have the money, So how you gonna give them fines if they are the one who got lower income, almost no money? And it's like they do it on purpose, And I see it because I'm going to both places, and I see the way how they treating Jake, So yeah, man, Jake, you are the face of you are the problem, That's why Jacob's troubles already started worldwide, and the elites make a pact with each other, So this is some clip I wanna play for you from the French president Macron. He's teamed up with Melinda Gates, the woman of Bill Gates, the gates of hell. And man, they pushing the vaccine, and you're gonna hear out the horse's mouth. They want to give everybody the vaccine. He said it like it is a need for everybody in this world. But when the devil cared about you, and I'm talking to you, Jake, that's why 1/3 is only gonna make it, because they are the elect, the one who pushing this word in truth and sincerity, who believe in the word, who believe the holy scriptures, who know the name of the Most High, Yahawah, Bahasham, Yahawashi. This the only one who's gonna be saved out of this, and a lot of us gonna be martyrs too, but we're gonna get that crown of life, That's why you need to endure in this time, And yeah, man, they are really, really busy to. And he said that it's not a mandatory yet, but when I can guarantee you, if they find the vaccine, you know, they're gonna make it mandatory that you're gonna take it, or else you cannot anticipate in this society, and it's gonna be everywhere. You know, they're gonna lock you out from it. Maybe they're gonna put you in jail. Maybe they want to force it on you with the military, kick in your door, and you know it's gonna be all kind of madness. So that is really gonna be Jacob's trouble, and we already know the brothers who pushing this in truth and sincerity, especially in Great Millstone. You know, we ain't gonna take the vaccine. Maybe the people from Nate and General Yahana, you know, his people, his followers gonna take that vaccine because he didn't prepare his people for this, you know. But I know for sure the brothers and a few sisters in who follow Great Millstone, they ain't gonna take the chip, you know, so of the vaccine. That's lucky, you know. But it's also, the chip is also maybe, of course, I heard a lot of that they want to put the chip like the 220 ID. They want to put also the chip in it, like everybody's digitized, you know. So, man, it's gonna be horrible times, you know. So you need to be prepared, Akim. But I don't want to go on a rant. I don't want to stay on a rant anymore. Let me play this clip.
Our co-leads in protocol order, the co-leads who have been working very closely with us to get this initiative off the ground and to reach out to partners. And I'm delighted to start with France. France has been the strongest voice in the call for action for vaccine 10 days ago with the World Health Organization. For France, Président Emmanuel Macron. Emmanuel, tu as la parole.
Merci beaucoup.
Thank you, dear Ursula, President of the European Commission, President of the Council, Secretary General of the United Nations, colleagues, ladies and gentlemen, heads of state and government, Director General of the WHO, ladies and gentlemen. On the 26th of March, the G20 leaders committed themselves to an international response to the COVID-19 pandemic, a response that would be massive, coordinated, and one of solidarity. And we've just heard that from Ursula. Now, on the 23rd of April, with the WHO, with all global partners brought together in record time with agreed principles, whether we're talking about states, foundations, private foundations, etc., we have launched an initiative to accelerate the creation of the means for preventing, detecting and treating, to guarantee equitable access to the means to combat the pandemic, and also to consolidate our health care systems to combat COVID-19 in the most fragile countries, and to pursue, of course, combating and controlling other diseases. I'm thinking, of course, of Africa in particular. The third pillar is vital. We have to step up the efforts to strengthen healthcare systems. It's a historical initiative, and I think that this conference today, organized by the European Union, is extremely important. Thank you, President. We want to draw all the lessons we possibly can from the past and past pandemics and their management, what's worked, what hasn't worked. With COVID-19, it is legitimate to say that it is for states to protect their populations, find answers, but we will not deal with this once and for all, except together. And that's what the initiative is designed to achieve. So we want collaboration between states, between vertical organizations, between foundations, but also private stakeholders in the pharmaceuticals sphere. So we want to focus on research, treatment, vaccine, although we know it's going to take time. And that's why at the heart of this initiative there is a decision we have to all take and support. When the vaccine is ready, it has to be a public good, a worldwide public good. It has to belong to us all. Of course, those who bring it about, who invent it, will be duly remunerated, but access will be given worldwide via the organizations selected and sound public and private structures that we will put behind this. The initiative, of course, needs to be financed, and we are there to play our part. Thank you, President of the Commission, for playing this part, which shows the will of Europe to live up to expectation. We want to step up this work to save lives, to end the uncertainty of this crisis, and to begin the reconstruction that will be necessary economically and socially in the aftermath. So we have to cooperate to ensure that we have the means to achieve this. We, for France, will take up our responsibilities. We need a WHO to deal with crises such as this. We need to consolidate its role in terms of warning and coordination, and we will step up our support to the WHO over the next 2 years. We need, as I've said, to accelerate work on the vaccine, which will be accessible to everyone, and because we have essential work to carry out on equitable access to therapeutics and diagnostics, and in terms of patents in particular, nothing will be possible on diagnostics, therapeutics and vaccines unless we support healthcare systems. Now, for all these reasons, 500 extra million euros will be committed by France in the ACTA initiative context, and this will be fully aligned with financing provided elsewhere in the Santé en commun or Health in Common initiative, which is 1.2 billion worth and is being spent by our national stakeholder, supporting NGOs and research organizations internationally. We want to help our African partners in particular to shore up their health systems. Commission President, you've said it would be a long path, and it will be. We need the vaccine and some therapeutics, but we need them in massive quantities, and we need to distribute them. And therefore, I would call on everyone to work towards that goal, and I can assure you we are committed.
Monsieur le Président, merci Emmanuel pour tout ce soutien à cette noble cause. And now we go from Paris.
More than 90 potential coronavirus vaccines are being developed around the world. Former FDA Commissioner Scott Gottlieb talked to Face the Nation yesterday about when a vaccine could be available.
Well, I think what we're going to have in the fall is hopefully multiple manufacturers that have cleared early-stage safety trials and have millions of doses that could be deployed in large-scale studies inside cities. And so what you would do is deploy the vaccine in the setting of an outbreak in a city to both test whether it's safe and effective, so you're continuing to study it.
And our Dr. David Agus joins us from Los Angeles this morning. David, good morning. You are involved in helping design some of the clinical development of a vaccine. How quickly do you think this could happen?
Well, listen, I hope and pray it's here by the end of the year. Data on some of the vaccines are mature in that they've taken vaccines that have been used before and put in the section for COVID-19. So they're skipping some of the early safety studies because they know it's safe, the majority of the vaccine, and we'll see the results over the next several months. If those results are positive, it's certainly possible that we have a vaccine in the fall.
What looks most promising to you, David?
Well, as you alluded to, there are close to 100 vaccine candidates around the globe, and about a dozen certainly have science behind them that makes sense. And there's the Johnson & Johnson, there's the Oxford University, there's the Moderna, there's the Pfizer. All of those make scientific sense and can be accelerated based on the data they already have. And so I'm encouraged. But the problem is that you have to make a very potent immune response for it to work. And we never know till it goes into humans whether that immune response is strong enough to provide immunity. That's the key question.
If we get something to work with here, David, who would get this vaccine first? How would that work, do you think?
Well, they say Anthony Mason is always first to get this. And then after Anthony it's healthcare workers on the front line are key, obviously. And then people at high risk for complications and being admitted to hospitals. Those are people with diabetes, obesity, blood pressure issue, and the elderly. Those are the ones that if they get the virus are the ones who get very sick and end up being admitted to a hospital. So we need people to take care of them. That's the frontline workers, as well as the high risk would be the first.
Are you expecting this would be seasonal, like the flu, a seasonal vaccine, or a one-time shot?
Well, I think with coronavirus, what we're afraid of is that the immune response will be good, but not great. And so what that means is you're going to need potentially yearly updates of the vaccine to get your immune response going. When you get the flu vaccine, it classically lasts for 4 to 6 months, the immunity to influenza. The hope is with this vaccine, it will last till the next year, and then another vaccine is given to basically boost immunity again and provide you another year of protection. But we're not going to know until we see what happens, until we see the immune responses. We should have the first data coming out in June, so then we'll know a lot more.
Mm-hmm. As you know, David, there are some people who are very skeptical about vaccines. What would you say to them?
There are people that are skeptical about vaccines. You know, I think in this case, we're going to have to do a vaccine no matter what. You know, the United States got, dramatically lowered its smoking rates with secondhand smoke, with the argument, it's not just affecting you, but it's affecting everyone around you. If you don't get a vaccine, the problem is there are a lot of people in the country who cannot develop enough immunity, even with a vaccine. And they may be some elderly, immune suppressed, cancer patients, and others. And so we all have to do it to protect each other. This has to be a communal event in order to get herd immunity so our country is protected. This is going to be everyone stepping up to be part of the solution. And so I hope and pray that there aren't large pockets of the country that don't get vaccinated.
Yeah. All right, Dr. David Agus. Thank you, David. We're all rooting for this by the end of the year. Appreciate it.
And then finally, we'll be moving towards this mass vaccination campaign and continuing to follow. And I want you to know that CDPH is already deep in the planning stages around vaccination. We've already bought the syringes. We already know where it's going to happen. We're thinking about what that's going to be. It's all part of this plan.
And the government now, but what does opening up look like? You know, which activities have, like schools, have such benefit and can be done in a way that the risk of transmission is very low?
Yeah.
And which activities, like mass gatherings, may be, in a certain sense, more optional. And so until you're widely vaccinated, those may not come back at all.
The book of Revelation, chapter 12, verse 12, and it reads, "Therefore rejoice, ye heavens, and ye that dwell in them. Woe to the inhabitants of the earth and the sea, for the devil is come down unto you, having great dread, because he knoweth that he had but a short time." And yeah, man, he knows his time is short, you know. So that's why he's coming with great dread on Jacob, you know, especially Jacob, also on his own, but especially Jacob, you know, because he want to get rid of Jacob, you know. He knows that his time is short too. You must imagine, man, that's why they released the footage of the so-called UFOs, the chariots of the Most High, you know, because they know that the end is near, you know, so they can't escape this. That's why they try to push this, and they try to play, they want to play for the Most High, you know. They want to be the Most High, you know. They want to sit on the throne of the Most High. And if he can get a lot of Jakes with him, you know, to his hell, he's going to be glad. And hell is not a place, you know, where you're going to burn for eternity. No, hell is a condition where you're going to live in, you know. Because the Edomites, man, they're gonna go to hell, man. And that means they're going to be in a lower condition, because the first shall be last and the last shall be first, you know. So it was written, you know. And Yahawah, Bahasham, Yahawashi, he's only coming for Jacob, you know. And I mean the elect from Jacob, you know. Ain't gonna be the 2/3 niggas, because a lot of you niggas, man, you deserve to die, man, because you're the worst, you know. You down with your enemy. You do all kinds of degenerate shit. You know, I was seeing a video like a demon Jake woman. You know, she was hitting a nigger woman. She was hitting on the baby. You know, almost choking the baby out. You're sick, man. You cannot enter in the gates of the Most High. You're gonna be cut off, and you're gonna come in back righteous in the new kingdom, you know. But a lot of you Jakes are degenerate. That's why the Most High is gonna start with his first. He's gonna start with his own sanctuary, you know, cut you off, and he's gonna use Esau for it, you know. He's gonna put the spirit on Esau to eliminate you Jakes, man. That is what happened, man. You know. So yeah, man. With this, man, I hope you was edified, man, and yeah, to the next lesson I want to say shalom.